Now I would like to introduce our speaker, Dr. Brian Thompson, Clinical Assistant Professor in the Department of Obstetrics and Gynecology at Upstate Medical University. Dr. Thompson, you may now have the floor.
Scano and Scoli means peace and welcome in Oneida. And it's a real pleasure to be able to do this talk today. I hope to at least leave some time for questions. I'm not able to see anybody. I can see my slides, so if there's any difficulty, if someone can just give me a heads up. But other than that, we'll go ahead and we'll get started. Does that sound okay to everybody? And we'll go ahead and we'll do that. So the talk today is about Native American health disparities, history and culture, which is a huge topic, but we'll get it squeezed into the time frame here. And like everybody else's history and culture, these are all intermixed together, disparities, history, and culture. So we'll go ahead and we'll get started. I wanted to start off with a little bit of culture. When the land that we're from right now in Syracuse is actually the land of the Onondaga. But in a larger aspect, it's the land of what we call the Haudenosaunee, or the people of the Longhouse, or is commonly known as the Iroquois, and is also known as the Six Nations. But before we gather, any of us gather together, we always give a thank you. And in Oneida, we call it the Ganahela Dunsla, or the words before all else. And I'll just give you a very small snippet of this, because otherwise it would go on for a period of time. But just to give you a little bit of flavor of the language itself, and we always try to introduce a little bit of culture in any of our talks. So I'll give you a little snippet. And in this particular part, it's really just is thanking everything that we're here for. So we actually thank the people for coming, then we thank the earth, we thank waters and grasses and trees and animals, and it kind of goes up towards the air, and we end up thanking the stars and the moon and our creator. But I'll give a little snippet of it. Agwe gus gaji adwawe nuni yunga nigula. Dai tina haladu ne yunkinoha ahunja. Jit segu yo diliwat danji du hadi. Datonio duhak ne yunga nigu. And there's so much, I mean, we could talk for days just about what I just said right there. But what it means, and that was in Oneida, and what it really means is that we're all coming together and we're wrapping our minds together as one. And that's a large concept, but we're all coming together as one people, no matter where we're from. We're wrapping our minds together as one. And we're thanking our mother, the earth, our mother, Yunkinoha, the earth, Ahunji. And we're thanking our mother, the earth, for carrying out her responsibilities. And then at the end of that, we say, this is how our minds will be. And we go through this whole process at the beginning of a meeting or a gathering, of small or large, and then we do it again at the end. So I just wanted to give you a little flavor of that. And to continue on a little bit of the culture part of the area that we're from, for all of us that are from Central New York, we probably see this on flags, and it's called the Hiawatha Belt. It's actually a wampum, and I'll show you a picture of it. This is another picture of it, but I believe my cursor works. But I'll try to explain it to you so that when you see it around Central New York or anywhere, you'll understand what it means. So this entire wampum belt, wampum is really clamshell, and the clamshell is white and it's purple. And I'll show you a picture of the actual belt that has a different color to it. But the white in the middle represents Onondaga, where we're from right now in Syracuse. And this is called the Tree of Peace, or we're actually at the capital of what we call the Haudenosaunee, or the Iroquois, or the Six Nations. And these two squares on the end represent other nations that are within this Haudenosaunee Confederacy, or Iroquois Confederacy. This one represents the Oneida, which I am. And then a little bit towards the east is the Mohawk. And then if we go west from Syracuse, this represents the Cayuga. And on the western, or the western door, is called the Seneca. And what's important about these belts, because they all have meaning, is that these lines that are in between these squares actually represent unity. So it means that we're all one. And these little bitty white areas at the end represent that anyone who wants to come and join this peace, peace under the Tree of Peace, or this confederacy of indigenous peoples, are welcome to come and attach to the sides of this belt. And another belt that's very important is called the two-row wampum. And it really talks about us as a people and how we relate to other peoples. And what it really represents is one people, and this would be the indigenous people, as one purple line. And this was actually the Dutch when this belt went into place back in the 1600s. And I'll show you an actual picture of this. This is just a replica. But this purple line here represents the Dutch, and it talks about our relationship for each of us. And what it means is that as indigenous peoples, we won't pass any laws, we won't pass any judgments, we won't pass anything that affects the Dutch or another people. And the agreement was that people who are not from this area will not pass anything to any laws or any judgments that will affect the indigenous peoples of this area. And we go through the river of life side by side, or side by each, in peace and harmony. And it really talks about sovereignty. We won't do anything, the indigenous people won't do anything to affect others, and equally others won't affect indigenous peoples. Now, obviously things have changed over time, but that was the original agreement. And that is still held to this day, at least from the indigenous people. And this is my personal picture, but these are the actual wampum belts that we were just talking about, a little bit different color than what you saw. This belt is still in place. We're not sure how long ago this belt was actually made. There's really no telling how long ago it is, but it's been preserved and passed down. The original belt itself, and this is a portion of the two-row wampum that we were just talking about before. And just to continue giving you a little bit of the culture and flavor of the area itself, this happens to be a picture of the Onondaga Longhouse. Way back hundreds of years ago, the indigenous peoples of this area lived in these long houses, and clans and families lived in these houses. They were huge, as long as a football field. But what it really represents, and now it's just kind of a long, large cabin, and this one happens to be at Onondaga, but everything in our culture occurs in this area, in this longhouse. Your indigenous name, your native name is given to you in this longhouse. When you're born, you're introduced to your entire community in this longhouse. We'll actually lift up the babies and carry them around the longhouse and give them a name and introduce them to everybody. And it's quite a thing to see all the babies. And it's special for me because I'm an OBGYN, I'm an obstetrician, and I deliver a number of these babies. And it just gives it a whole new meaning to be able to to help with the birth of these children, and then to see them get their name and see them grow up in the culture itself. But what it and your weddings are in here, your funerals are in here, your ceremonies are in here, uh, politics are in here. Everything occurs within the longhouse. But in a larger sense, what it really represents is the floor of this longhouse is Mother Earth, and the roof of this longhouse for our people is the sky. The wind, the clouds, the stars, everything is the top of the longhouse. And the edges of these doors, just like on that belt we were showing, are the ends of the land that we hold. So it's really a representation of a whole nother concept. And I think for all of us, at least who follow indigenous stuff, we always feel that water is so important to us. And in Oneida, it's called a Neganos Haguha. And if we always give thanks to the water, and the water, we actually say within this Thanksgiving that the water is continually carrying on its responsibilities. Yodeliwat Duhadi. Water is continually carrying out its responsibilities, and the concept really means is that for something to carry out its responsibilities, it has to be alive. So we believe everything is alive. The earth is alive, the grasses are alive, the trees are alive, animals are alive, water is alive, wind is alive. All of these things are alive, and we're able to, and we're alive, and we're able to become as one. So environment is so important to indigenous people. But you probably heard the concept, water is life. But every day and every gathering that we have, we say that water is also alive. So we'll kind of get into a little bit of some native healthcare issues, and we'll hold some questions hopefully for the end. But just to kind of do an introduction, based on the 2010 census, we don't have the information out for the 2020 census yet. There are about 5 million Native Americans that live in the United States. And the American Native population is a growing population. It's almost a 20% increase since the year 2000. And there are many, many nations who consider themselves native. So in the United States proper itself, there are almost 575 sovereign Indian nations itself. And what state has the highest population of American Indians? It's actually California, with about almost 15% of the Native American population in the United States. And where does New York rank in all this, since we're really talking from New York itself? And New York State actually ranks 5th in Native American population, behind California, Oklahoma, Arizona, and Texas. New York has about 4% of all Native population in the United States. In New York itself, when we try to go down to the state level itself, there's 220,000, and this is of 2010, 220,000 Native Americans that live in New York State itself. And that's almost a 30% increase from 2000 to 2010. And approximately half of all Native Americans who live in the Northeast live in New York State. And for some who have seen presentations like this before may know the answer to this, but what city has the largest population of American Indians in the United States? And you'd be a little bit surprised that Anchorage is number 5 with about 35,000, and Oklahoma City, which has a large Native population, has about the same. Phoenix has even a larger population, Phoenix, Arizona. Los Angeles has about 55,000 Native Americans that live in it, but the city with the largest population of Native Americans in the entire United States is actually New York City, with almost 112,000 Native Americans that live within it. twice as large as any other city in the United States. And we don't even think about this. It's not really on our consciousness to know that 4 hours away from us, the largest city in New York City has the largest Native population in the United States. And we have lots of health disparities that occur. So approximately 50% of Native Americans in New York State live in New York City. And as we start to go a little bit even more into the demographics, about 80% of Native Americans live outside their native nations, outside their native lands, which would be commonly called reservations. And according to the Indian Health Service, about 60% of Native Americans live in cities and urban areas. In New York State itself, there's a lot of economic disparity, characteristic of all people. But about 30% of Native Americans live below the federal poverty level in New York State, which is about twice as high as that of the general population. And back in 2010, with that census, it was the highest of any race or ethnicity. In 2009, almost 40% of Native children lived below the poverty level. Also incredibly high economic disparity and very low household income itself. And we'll spend it's hard to not talk about COVID in these times, and we'll talk about it a little bit towards the end. But premature deaths is something that's very evident within Native American population. And Native Americans in New York State have the highest rates of premature death, defined as an age that's less than 75 years old. And approximately 70% of Native Americans in New York State passed away prior to age 75, compared to about 34% of white non-Hispanics. Obesity is a large issue in terms of Native American population, with lack of adequate food and food deserts. But about 15% of Native American children are obese, and these rates increase greatly as you go into high school, where almost 30% of Native American high school students are considered obese. Has a lot of obvious health effects that go with that. Most particularly is diabetes. And something that, I caution, just even bringing up the slide but something that, we all need to really understand is that the rate of Native American high school females, and this is actually from New York State data, the New York State Minority Report, from a few years ago, looked at what are the rates of Native American high school females in New York State that reported being forced to have unwanted sexual intercourse. And the numbers are just so terrible to even have to discuss. But approximately 5% of white and Asians report these statistics. But for Native American females in high school, it's almost 50% that report this. Just incredible statistics, and have so many implications in terms of trauma and health disparities, even within itself. Some of the leading causes of death in New York State, and some of this data is a little bit old as we wait for some of our new census numbers to come out. But the death rates are not calculated due to incomplete reporting and small numbers, but what is reported within New York State shows, at least at that time, COVID has certainly impacted that. But heart disease, cancer, unintentional injury, liver disease, diabetes, and chronic respiratory diseases were noted to be the highest causes of death during this period of time. What's interesting is if you look on the New York State Department of Health website, there hasn't been in a number of years a new New York State Minority Report. I wish there was. I wish that it was updated, but you know, it would be good to be able to see some of the more recent numbers itself. As we look at nationally, when we look at some of the Native American health statistics, probably not too surprising, alcoholism has incredibly high rates, diabetes has incredibly high rates, unintentional injuries, homicide, suicide, and life expectancy is less than that of other races and ethnicities in the United States. Cervical, and as an OBGYN, cervical cancer is higher, maternal mortality is higher. When you look at death during childbirth itself, pneumonia, sepsis, chronic liver disease, all part of our health disparities of people of color. Some of the stats, when you look at dental disease itself, which we don't quite think about, what percentage of Native American children suffer from dental caries by the age of 8? And about 90% of Native children suffer from dental caries by age 8, compared to about 50% nationally. So just imagine that you know, as a Native child, that growing up where, you know, in your own native area, that you know, essentially all Native children are suffering from dental caries, and the difficulty with access to care, the difficulty with treatment for that itself. How many decayed teeth do Native American children suffer by age 2 to 5? On average, these Native children have about 6 decayed teeth by age 2 to 5, compared to 1 for all other races. So there's a huge disparity, huge difficulty with Native children receiving dental care, and as a child going through that of the stigma of having that type of dental disease itself. Violence against Indigenous women is another huge issue. American Indian Alaska Natives are about 2.5 times more likely to experience violent crimes, and as we discussed before, to experience sexual assault crimes. And about 60% of American Indian Alaska Native women, about 3 out of 5, have had some type of an assault during the course of their lifetime itself. And we'll talk a little bit about one particular area in South Dakota, the Pine Ridge Reservation itself. The population of the Pine Ridge Reservation in South Dakota is approximately about 20,000 citizens that are Lakota that live at Pine Ridge. The Pine Ridge Nation itself, the reservation, is huge, vast area, almost 3 million acres of land in southwestern South Dakota. And you know, it's almost as big as Delaware and Rhode Island combined, but incredible, extreme poverty itself. Unemployment at 80%, per capita income at about $6,300, 8 times the rate of tuberculosis as any other part of the United States. Alcoholism at a rate of approximately 80%, 25% of children diagnosed with fetal alcohol syndrome. And when you start to add all of these things in together, you really start to increase rates of suicide. So teen suicide, mental health disease, all of these health disparities start to come to bear. Infant mortality is also very high itself. And a report from the South Dakota Office for Comprehensive School Health had noted that about almost a third of Native Pine Ridge students who were in high school had considered attempting suicide, considered attempting suicide, and about 15% actually attempted or tried to attempt suicide within the 12-month period of that report. It is really a difficult problem. And what is the average life expectancy? Usually when I try to do these talks, I'll ask these questions and wait for a little bit of responses. But what is the average life expectancy reported on the Pine Ridge Reservation itself? And the life expectancy on Pine Ridge is actually the lowest of anywhere in the United States itself. And the life expectancy for men is about 47 years old. And for women, it's about 55 years old. And this is from the Pine Ridge Hospital itself, a place I've actually visited. The average life expectancy in another report from Pine Ridge was about 60, almost 69 years old. But really, on the same level as Iraq and Sudan and India. But that's really some of the health disparities that we're dealing with within the Native American community itself. And I wanted to kind of shift a little bit and for all that aren't really aware, and try to explain, how do Native Americans get their health care? Through a government-to-government relationship, through a trust responsibility of federal and state governments for acquisition of land that we're all now living on through treaties. The federal and state governments have had a trust relationship to provide for the well-being of Native Americans. And part of that came out of that is something called the Indian Health Service. So health services for American Indians and Alaska Natives began out of this government-to-government relationship, which is unique for Native Americans for providing the land that we live on and other things. But this trust relationship is a role of a guardian that the United States provides for health services. So, just like a veteran can go to a veterans hospital itself, a VA hospital, Native Americans can go to an Indian Health Service hospital or an Indian Health Service clinic. And this was placed into law through what we call the Snyder Act, which was in 1921, which authorized funds for the relief of distress and conservation of health of Native Americans, and for the employment of physicians for Indian tribes throughout the United States. And the Indian Health Service actually in the United States operates about 31 hospitals, about 52 health centers, school health centers, health stations, and then also now Native American nations throughout the United States, through self-determination, can actually operate their own healthcare system. So a number of Native American nations in the United States have hospitals or clinics that they receive funding through the Indian Health Service to provide for their own people. An example of this is Oneida, which the Oneida Nation of New York, which is not too far from here. They have an Indian Health Service clinic that they receive funding for to provide for the health care of Oneida people. And it's broken into regions. Obviously, we're here in New York. So this big, large area right here is the eastern region of the Indian Health Service. But it's broken into regions itself of Indian health care. And when we look at, and we'll, we have about 10 minutes left, so we'll be for that 40-minute talk. We'll talk a little bit about COVID, but it's difficult to talk about what the healthcare expenditure is for the Indian Health Service when you really compare it to all of us that receive healthcare. So in 2018, for a Medicare beneficiary, the average cost per capita per person for Medicare was a little over $13,000 per beneficiary in the United States. For veterans, it was about $9,500 per person, and we have all heard about the difficulties with the Veterans Administration. Obviously, it's improved, but still has a lot of difficulties that are within it. The Medicaid spending per enrollee is approximately $8,000, but for Native Americans in the United States, who through a trust responsibility, through a government-to-government relationship, depending or dependent upon treaties to provide that actual IHS spending per user is about $3,800 per person in the United States. So for a Native American who receives their health care, that spending is only about half of that of a Medicaid enrollee in the United States, and about a third of that as someone who is receiving Medicare. And we have just a few minutes left, and I wanted to go over a little bit about COVID itself, and hopefully to leave some time for any questions itself. But when you look at the low amount of funding per Native American enrollee in the Indian Health Service, when you look at all these healthcare statistics and health disparities that we talked about, and you look at where most Native Americans live in very rural areas, you can imagine what the impact of COVID-19 has been to the Native American population in the United States. Because of this underfunding of the healthcare system, COVID-19 has been devastating to Native people. And I just wanted to go through a little bit of statistics because it's really not, once in a while it's talked about on TV and you'll sometimes see it, but it's really not discussed very much. So I tried to provide, the most recent data that I could find, and through APM Research Lab on January 7th of this year, they published some statistics on the color of coronavirus and COVID-19 deaths by race and ethnicity in the United States. And just over the past, and we can, you can kind of see it for Indigenous people itself, the amount of fatalities as a result of COVID-19 has actually just continued to escalate itself. And when you think about that when there's only about 5 million Native Americans that live in the United States, and when you think about the cultural structure of Native Americans in the United States, it's very dependent on the family itself, and especially on elders. And this is a disease that's obviously affecting our elders. It's just incredibly devastating to the Native American community. And from December 21st, so about a month ago, less than a month ago, the statistics for Indigenous peoples in the United States is really on the rise for actual mortality rates itself. It's something that I hear about on a daily basis of the amount of severe impact of COVID itself. So approximately, about 1 in 600 Indigenous Americans have passed away from COVID-19. And this data is through January 5th of this year. And when we talk about the impact in terms of the culture, when we talk about the impact in terms of the family unit, it is incredibly devastating. Most of the deaths itself have been where clusters of Native Americans live, especially in the southwestern area in Arizona, New Mexico, but also up in South Dakota, North Dakota, Montana. But if you also look, there's a cluster in New York State itself. However, when we start to look at the New York State numbers itself, all that we can see that's reported by the Department of Health is other. And we see that so much when we look at Native American data, when we try to tease this out a little bit. Native Americans are always put into the other category as, or not applicable, it's just as like N/A. But when you look at our own New York State COVID-19 tracker website, we don't list Native American fatalities. We're just considered an other category. And just earlier this week, the New York Times had really did a wonderful article on what we had just got done talking about of the effect of COVID-19 on the devastation of the Native American community. Tribal elders are dying from the pandemic, causing a cultural crisis for American Indians. So the way that the Native American cultures are set up, they're maternal, matriarchal lineage, and they're very dependent. To lose one elder in the Native American community is like losing a library. A lot of what's passed on in terms of oral history, in terms of history, is oral history. It's not written down, there's no books. So when you lose an elder within the community, and this is a disease that's really causing a lot of mortality within our older population, you're losing oral history, you're losing songs and ceremonies, and you're losing language, which is a huge thing. When we start to lose our language, many of these areas have so few native speakers that are remaining. And when we lose them, it's gone forever. And when we look at some of our matrices for COVID vaccine distribution, or even funding from the federal and from the state levels, it really doesn't incorporate cultural awareness or cultural humility in any of these numbers or any of these matrices. So we'll kind of pull it back together a little bit in just this remaining small portion, but it really has to do with Native sovereignty. And we discussed at the beginning a couple belts, the Turo Wampum and the Hiawatha belt. So when you look at and I'll take, for example, COVID vaccine distribution, even within our own state, within New York State, it was for 75 and older, and now it's 65 and older. But it's difficult to justify that when you look at the life expectancy of Native Americans that's less than that category in of itself. And for some areas of the United States, it's 65 and older, which is really just the life expectancy for Native Americans. And even when we look at it on a deeper level, through the federal government and the state government, the federal government, and we'll talk about COVID vaccine, the federal government is providing COVID vaccine distribution to individual Native nations. But once the federal government releases usually Moderna COVID vaccine to these individual native nations, these native nations are able to provide vaccine distribution in a way that's culturally applicable to their individual native nation, meaning that they're able to vaccinate their elders, they're able to vaccinate their cultural caretakers, their language holders, to be able to continue the culture. However, when you look at some individual states, it's so tightly held that matrix, that vaccine distribution is not able to be penetrated. And it's really an issue of native sovereignty, where a state will say that you can provide vaccine, but only how the state asks you to provide it, not how that individual native nation desires it to be done. The native communities that are within New York State consider themselves sovereign areas, as all native nations do. So it's a nation within a nation itself. And some of the solutions that we can do is to develop, like we do here at Upstate, is native nation to medical school collaborations. And we place sovereignty as a top priority. And we see what the individual native nation desires. And we attempt to accomplish that. And we build trust and partnership as advocates, as equal partners. And we look at things such as childhood and generational trauma, early mentorships for native children. And we develop culturally sensitive programs. And we try to incorporate some traditional values, just like what we're doing in this talk today. And I wanted to end with another wampum bell, and this one's called One Dish, One Spoon. This is actually another one of my pictures that I took of seeing this belt, and it's called the wampum bell is called One Dish with One Spoon, and what it means is that as we're talking about health justice and social justice itself, is that, and I'll kind of focus in on this a little bit. This purple area here represents a dish, and the white area represents a spoon. And how it was originally taught was that our peacemaker came to this area and taught. And as they all sat in a circle to be taught, a dish was passed around with a spoon in it. And the food that was in it was actually beaver tail, and beaver tail is actually very nutritious. And the concept is that everybody take a little bit, but have enough that everybody is fed. Don't take and then somebody else doesn't have. That we're all able to eat from that same dish. And that we use a spoon and not a knife, because if we use a knife, then you can have war. But if you use a spoon, then we can have peace. And this concept of providing for the most vulnerable, of providing for the most invisible, for the ones who aren't represented, who are the ones that are marginalized and invisible. And it's not just the native communities in our area. There's so many invisible communities and marginalized peoples. But we have to remember that as a people, as human beings, as we go through life, to incorporate everybody into that, so that each one of us are fed from this dish with one spoon. And for that, I think I'll go ahead and end. So I'll stop sharing here.
Thank you, Dr. Thompson. So now our chat monitor staff is just going to read out one or two questions. Unfortunately, we do have to end the session, at 11:55. But I'm sure I'll ask Dr. Thompson if hopefully he's more than willing to share his contact information, and you guys can reach out to him if you have any more questions. So I'll let Steph take the floor.
So the first question comes from Caitlin Nye. Her question is, this point about trust building is so important. There is such a history of harm from U.S. healthcare system to indigenous nations. How can we repair, build trust, to even get to collaboration and advocacy?
A great question, absolutely. I mean, what we're doing right now at Upstate, what we're really striving to do is to build that type of relationship. And the way that you do that is first by respecting each other on an equal footing. And it comes over the course of a long period of time. You're talking about centuries of distrust, and we're not going to correct that overnight. But through the process of gradual movement that occurs over time, you start to build that trust and partnership. So you start to work on things that the individual Native nations desire, for maybe for a medical school, and maybe healthcare issues, or maybe it's education, and we start to try to find what is a common interest and work on it together, but knowing that it's going to take a long period of time. And having sustainable goals and sustainable development that lasts longer than we'll all be around.
Thank you, Dr. Thompson. Another question comes from Lawrence Show. According to U.S. government stats, Native Americans have the highest rate of low birth weight, but also the highest rate of high birth weight. Thoughts about what is responsible for this U-shaped distribution?
Sure, of birth rates itself, absolutely. So when you start to have chronic disease states, for example, type 1 diabetes, you start to have bad hypertensive disorders, you'll actually have intrauterine growth restriction, or you'll have smaller babies itself. So common sense way, if the placenta itself is a nutrient source, is through the effects of diabetes, hypertensive, or other disease states, isn't functioning well, you'll end up with a smaller baby. On the other hand, when you have type 2 diabetes or gestational diabetes itself during pregnancy, it results in larger babies itself through caloric disposition to the baby itself. So you end up with much larger babies. So you do have this U-shaped dilemma in terms of Native American children.
Thank you so much, Dr. Thompson, and thank you, Steph, for reading the questions. So unfortunately, we are just about out of time, but we just want to thank everybody, and especially thank you, Dr. Thompson, for sharing so much knowledge with us. So again, thank you so much, Dr. Thompson. Thank you, everybody, for coming to learn more about this amazing topic, and we'll see you at 12:30.
Have a good day. Ona.
Thank you.